could you describe for us the similarities and the differences between GLP-1 medications and bariatric surgeries? And also, Brandy touched on this, where we speak with a lot of members that say their food noise and appetite comes back after a bariatric surgery. And can you explain why would that happen? And also, do you combine surgery with GLP-1 in your practice as well?
Yeah, I do combine the treatment, and I think you should always offer, an intervention that actually works. If your patient, requires it from it. In terms of the differences, obviously, surgery is more invasive. It's an operation. Medications are a lot less invasive, so the risk is a lot lower. We know these medications to be very safe, from the data that we have. The risk of, severe complications like pancreatitis or hypoglycemia, very low sugar. So, with surgery, it's more invasive, but surgery is more effective, like I discussed. With the GLP-1s, typically, when you look at the data on wegovy and things like semaglutide, it's about 15 to 17% total body weight loss at over a year. And with weight loss surgery, it's more 20 to 30%. But with Mounjaro, I mean, some patients are losing 25% of their total body weight, 30%. So I think eventually I'll reach a point where I won't have this job anymore. and because these medications are getting so damn effective, which is great. From a surgeon standpoint, it makes
you'll be ready
sad.
to retire by then, and you'll be sitting fat. It'll be fine.
Yeah.
Right.
You'll just
right.
be on podcasts,
That's
living
right.
in Italy,
Yeah.
whatever,
Yeah, I mean, which, some of the studies, like I said, on Mounjaro and, Triple G, these medications that haven't come out and are still in phase 2, they're very, very effective medications. And so we're very excited, as obesity practitioners, to be, with the potential of offering these medications. But, for now, the medications that we do have are not as effective as weight loss surgery.
Yeah.
The similar. So weight loss surgery causes hormonal changes. So bariatric surgery is also known as weight loss surgery, is also known as metabolic surgery. And the reason is because it induces metabolic changes. It causes hormonal changes. And one of the primary reasons it's so effective is because of the hormonal changes that it induces. So it decreases certain hormones that induce hunger. So it decreases a hormone called ghrelin. Ghrelin hormone that is in the outer part of the stomach, and that's the part of the stomach that's removed during a sleeve. So when this hunger hormone, patients feel less hungry. Satiety hormones are increased, so patients feel more full. And actually, if you look at the data in GLP-1 levels after weight loss surgery, they actually increase. So it's like taking GLP-1s. So after weight loss surgery, like the sleeve or the gastric bypass, the levels of GLP-1 increases. So it works in a similar way. But obviously, GLP-1 agonists just focus on the GLP, whereas weight loss surgery, you're hitting the GLP-1, you're hitting the ghrelin, you're hitting the leptin, you're improving the efficiency of insulin and the sensitivity of insulin. So it works in different ways. And, like the triple Gs, they're targeting 3 receptors rather than 1. So I imagine, they'll be more effective.
So how does regain and the food noise come back if the ghrelin and the external hormones are somewhat removed?
That's a very, very good question, and that's a question that practitioners don't really have an answer to, and it's hard to know. But what I imagine is over time, the effects, these hormonal effects, disappear, or they decrease, and these hormones kind of start to rear their ugly heads, right? So you start getting that hunger again, and you get that food noise. Oh, let me have a little, another piece, or you start getting the cravings, and so is that over time these hormones that are being affected recur, and you get increasing levels over time. I mean, from our data, weight loss surgery has very, very good long-term outcomes, at about years, the majority of patients are able to keep their weight off, but there are a significant number of patients that can regain weight. In some studies, it can be up to 30%. It really depends on how you define weight regain.
Mhm.
It differently, whether it's an increase in 50% of your lost weight, or once you reach a BMI above 30. So in all these different studies, they define weight regain differently. So it's hard to get a concrete idea of what the rate regain is, but in general, the vast majority of patients who have weight loss surgery tend to keep the weight off. Although you start to regain some of the weight, like Brandy had mentioned, after a couple years. Sometimes it's a little earlier, but usually it's around 2 years after surgery. The max benefit from surgery is within the first 2 years.
Okay. Interesting. And adding on to that, so do any neurological, of course, we touched on hormonal as well, changes occur both when your body gains or loses weight?
Yeah.
Yeah.
I
And could
mean,
you
I
describe that for us?
Yeah, I'm sure the other physicians on the podcast have discussed the fact that obesity is a chronic inflammatory disease. So obesity is really a unique condition or a unique disease because it affects every single part of your body,
Mhm.
and none of diseases do this. Obesity affects every organ system from your head down to your toe, whether it's causing headaches, increasing your risk of things like Alzheimer's, causing cardiac effects. It affects the endocrine system. It affects the renal system, your kidneys. It affects, your joints. So essentially, it's a condition that
Everything.
affects everything, absolutely everything. So it's a chronic inflammatory disorder, and when you have chronic inflammation in the brain, you get things like cognitive impairment. Like I said, it increases your risk of Alzheimer's. It can increase your risk of depression, obviously psychiatric disease. So it's really a disease that is pretty it's all encompassing and pretty devastating to the body, especially if it progresses to the point where your BMI is in the severe obesity category, and now you have a BMI of 40 and above. And it also increases your risk of mortality. If you look at a graph of mortality, which is the risk of death, if you graph the risk of death against weight, the graph looks like this. And actually, it's pretty flat, and once your BMI reaches 40, it curves. And so your risk of death increases as your weight increases, because it's a condition that affects every part of your body, from your heart to your lungs to your kidneys, to your bones, and obviously your brain.
Wow.
Nobody has ever said, and we've had all the doctors on
All
the line,
encompassing.
has ever said one that it's all encompassing, and no one's ever called it like a chronic inflammation issue.
Yeah.
It's a
Like nobody's ever said it. We always talk about inflammation, but we don't talk about like that core of it. Like,
yeah,
and we all for sure, like,
yeah.
like I would take this forever just to keep the inflammation away, like,
Ab-
and not
absolutely.
hurt my organs, like trying to process friggin' whatever anti-inflammatories, NSAIDs.